Is live to explain how hospitals in our area are preparing. Todd?
Well, Mike and Carol, the latest case of Ebola may be more than 1,000 miles away in Texas, but that isn't stopping officials here. Places like Froedtert are preparing just in case and when and if the virus arrives here. The Centers for Disease Control confirming the latest case of Ebola in Texas Sunday, word that have officials worried.
It's deeply concerning that this infection occurred.
A nurse who treated the first Ebola patient diagnosed in the United States is inside an isolation unit at a Dallas hospital, now fighting the deadly disease herself. Troubling news that have healthcare facilities in southeastern Wisconsin preparing.
We are ready. It's our responsibility to be ready.
Dr. Sid Singh is the Associate Chief Medical Officer of Froedtert in the Medical College of Wisconsin. He tells me there's an arsenal of equipment here and safety procedures to keep both patients and employees safe.
Our focus is on the isolation equipment as well as the procedures of how to appropriately use this equipment so that bodily fluids of a patient who may have Ebola virus disease doesn't come into contact with the person who's caring for them.
Things like gloves, eye protection, even special isolation rooms. The CDC believes there was some sort of breach that infected the nurse caring for Thomas Eric Duncan in Dallas before he died.
Why is it necessary for preparations here in Milwaukee when cases of the virus have turned up more than 1,000 miles away?
That's a good question. It's very easy for people to travel from one part of the world to the other. There can be diseases that can come with the people.
Definitely some good advice and information there. Now, Dr. Singh telling me today because Milwaukee is so close to Chicago with an international gateway at O'Hare, they can never be too prepared. We're live in Wauwatosa tonight. Todd Hicks, today's TMJ4.
Yeah, very true. Thank you very much, Todd.